Hi everyone, Dr. Remy from Pain Free and Fit and Posture Size. Today I'm going to be sharing with you a great lower back conditioning exercise that helps with degenerative disc disease, known as the one-legged inverted plank. Hope you enjoy. So I just got done with a great set of heavy sumo lever squats for lower body training today. And I finish off with a couple of accessory exercises for my core, and I'm going to share with you today the one-legged inverted plank. That's a great glute strengthening, ham strengthening, and extensor low back strengthening exercise to help with degenerative disc disease, of which, of course, I know a lot about because not only have I suffered with it, I've helped lots of patients and students over the last 30 years with this exercise. So here's what it is. We engage our RPI, or reverse posture isometric. If you're not sure what that is, please go to either the Pain Free and Fit website or the Posture Size website. We have a free body analysis. You'll have to know how to contract all your supporting musculature in your lower back and hips. If you have a tendency to hip hike on one side, internally or externally rotate a hip, if you have a weak multifidus muscle, if you have an abnormal contracting internal oblique when you try to engage your deep core transverse abdominis. You need to know all these corrections first so that while you're doing this or any other healing exercise, you're strengthening proper function, not dysfunction. So for the one-legged inverted plank, we simply go off of, once we engage all of our RPIs and corrections of our core, and we set the core, as we raise the legs up and bring our hips parallel with or level with our shoulders and ear, we're simply going to raise one leg up a little bit. Now a regular two-legged plank stresses the glutes, it stresses the hamstrings, it stresses the lower back, but especially on one leg, now we're also getting a lot of hip musculature and lateral musculature to prevent us from hip hiking or bringing that hip up on our standing side. In this case, I'm standing on my left leg, raising my right. So I don't want to hip hike or raise my left hip up into my rib cage. While I'm up there, of course, I'm thinking about keeping my tail under and squeezing the glute. If I have trouble squeezing the glutes, if my glutes are weak, I want to make sure I keep tail under tension greater. Once you set the proper amount of tail under tension based on your RPI, you want to crank that tension of pubic bone towards your lower rib cage or chin and tail under to squeeze that glute. If you begin to feel some tightness in your hamstrings, you can lock the leg out a little bit greater, meaning straighten the knee. That'll engage your quads, release your hams, and you can cycle back and forth from right to left legs, whatever you have. 10 seconds, 30 seconds, and this is a cluster set where we don't wait with rest in between. We just keep going back and forth, right to left, for anywhere between 3 and 5 sets per leg. Start off with maybe 5 or 10 seconds per leg. They're tough. Make sure you're keeping the hips up. The biggest mistake is dropping the hips, hip rotation away from the side that you externally rotate a leg. If you usually turn a leg out on your right side, your pubic bone is going to want to rotate away the other side. And of course, if you have forward head posture, that's going to be an issue. So keeping the head back, the hips up, locked in as you hold that contraction is the key to the one-legged inverted plank. If you enjoy this exercise and would like to learn some more, subscribe to our channel. We got a lot of great exercises for degenerative disc problems. If you would like to enjoy more of degenerative disc healing exercises, we've got a great exercise program, the Fast Track Healing Program for Degenerative Disc, available at the Pain Free and Fit website. Any questions or comments, please leave them. I'll do my best to get back to you. Otherwise, I hope you enjoy the one-legged inverted plank to help with your degenerative disc disease.